So over the 20 years that I've been practicing, one of the most frequently asked questions from patients is, if they're missing a tooth, do I really need to replace that tooth? How important is it? Because a lot of times they feel like they're really not missing out on anything, especially if it's a tooth in the back and nobody's seeing it. Obviously, there's a lot of negative consequences to missing teeth, even one tooth. We always tell them what's going to happen. Obviously, one of the first things that will happen is you're going to start losing the bone around that area, which not only affects that area where the tooth is missing, but the two teeth around it. These teeth around it are going to start shifting. They're going to start moving, which is going to affect their bite. So the way the teeth come together is going to change, and find a way to compensate for that. Which then affects their jaw, which then could lead to other issues with their TMJ. We've got to replace the missing tooth, even if it's one tooth. And the reason is we've got to get your bite back to a stable bite, to a healthy bite, because when we're not chewing and we're not grinding our food properly, it's not getting digested properly, which causes more intestinal problems, more GI problems, and ultimately overall health consequences. So by having even one missing tooth, really it will eventually result in a domino effect where it's going to cause other problems that will affect your overall health. One of the other commonly asked questions that we get all the time is, why not just get a temporary solution like a temporary flipper or a partial denture? Now obviously that is an option. It's not the best option, and one of the big reasons is not only are you losing bone in that area, but over time your teeth are shifting. By not replacing that one tooth or two teeth, especially in the front, you're going to cause many more problems in the future. It's going to take you more time. It's going to be more costly to find that fixed solution.